Hello, I'm Dr. Bang Ji-sung, the hair expert who looks after your hair. It's a pleasure to meet you. The first thing people ask about are the side effects. Especially when mothers bring their sons in, they always ask me. It's really okay, right? My son will be fine, right? They always confirm this. I understand how they feel, and I'm the one who actually interacts with the patients. I prescribe, observe reactions, effects, and side effects. After looking at research papers and listening to other doctors' opinions, I can say definitively that yes, there are side effects. But they exist, they're just not serious, so you don't need to worry. That's the conclusion. There are several side effects you're curious about. So, let me go through them from top to bottom. First, when you take the medication, it causes changes in male hormones, which can lead to a slight feeling of melancholy. It seems to cause some psychological anxiety, and there have been actual reported cases of depression. And your mood changes. The very act of taking this medication can lead to a slight drop in confidence, but indeed, some individuals genuinely experience minor mood swings. So, you might experience a bit of melancholy or lethargy. Those kinds of things can occur. Some also say they feel a bit foggy. Honestly, the people who feel this tend to be more sensitive. In any case, it seems your mood can change a little, but it varies from person to person. That's what I can tell you. Next, what men frequently bring up is their chest area. We're talking about things like lactation, breast enlargement, and what's known as gynecomastia. There are people who report these symptoms, and when they come in for a consultation, they're told this is because of the medication, so you should stop taking it. There are indeed cases where people describe symptoms like these. However, this too usually appears to be a passing symptom. So, don't take it too seriously. However, if you really do experience symptoms, it is advisable to visit a nearby clinic for a consultation. That's what I would recommend. Next, we have the liver. Your liver can become fatigued. This is because the medication is metabolized by the liver, which can lead to some exhaustion. This would include individuals with elevated liver enzyme levels, hepatitis carriers, or those who frequently experience high stress and fatigue and take liver supplements. That being said, I have never encountered a single patient whose liver enzyme levels dramatically surged, or whose liver was truly severely damaged, leading to a serious situation. It may affect liver enzyme levels, but no major changes occurred. Now, what you're really interested in is what happens down there. So, decreased libido, beyond decreased libido, there's erectile dysfunction and ejaculation disorder. Those are the main three. And it's quite common for patients, while on the medication, to discreetly mention these kinds of concerns. It can happen, but whenever I discuss this specific issue with urologists, they often emphasize that. Psychological factors are a major component. Honestly, issues like decreased libido and erectile dysfunction don't just arise from physical problems. They often have roots in mental and emotional factors. Therefore, it's not always accurate to attribute them solely to the medication, but if we talk percentages, it's actually much lower than one might expect. It's only a very small percentage. From my patient's perspective, the most common complaint I hear about is fatigue. And they often mention feeling a little gloomy or melancholic. They say that quite a lot. Side effects related to male function are rarely reported, but when they are, there are things I often have them do. I say this all the time. Drinking water, I tell them to drink more water and do leg exercises. Squats. Try doing about 5 sets a day, with each set consisting of 15 to 20 repetitions of squats. Try this for just a week while taking the medication, and see if you still have those side effects or any discomfort. And many people say they felt better in those situations. So, it would be beneficial to alleviate your symptoms in that manner and maintain your medication regimen. That's what I always tell them. Just because you're taking the medication, it doesn't mean you'll completely lose function or transform into a woman or that something truly terrible will happen. So please, there's no need to worry excessively. I really wanted to make that clear. Always consult with your doctor before starting medication treatment, and if you experience any uncomfortable symptoms, be sure to discuss them. I hope to have the opportunity to discuss this in much greater detail next time. I will see you again then.